My name is Dr. Erin Elliott, DDS, and I am a dentist at Post Falls Family Dental. Most people, when I come in and do an exam and ask them about snoring or if they have sleep apnea, look very surprised. Like, why are you asking me this? But the mouth holds a lot of clues. And the way that dentists can help is for patients who have been diagnosed with sleep apnea and have a c-pap and are not using it. We can actually make an oral appliance that's very simple in its design that helps pull the jaw forward, which in essence opens up the airway so they breathe at night.
A little bit skeptical about whether I had apnea or not. I did snore, and my wife has mentioned that more than one time in our marriage. And so I decided to go ahead and take the wear the sleep apnea device for the night to see, and lo and behold, I was an apneic, and decided that the best thing for me to do was to see if I could correct that.
Basically, the sleep apnea I treat is called obstructive sleep apnea, and that means that the airway collapses in on itself so that you don't get any oxygen flow to the vital organs such as the brain and the heart, and so your body works overtime in order to try to get that. One of the things that can occur is you can get diabetes, stroke, increase in heart attacks, aneurysms, just general fatigue as well. You know, most people don't go to the doctor as much as they come to the dentist. And so when we do our exams, we look at the oral, not just the teeth, but everything around it. And they see us twice a year, and we usually know their wife or spouse, and so we know how much snoring they really do. Most people who snore tell me they sleep just fine and they don't make any noise because it doesn't wake them up. It makes the person in their bed wake up. And then I also have a lot of patients who have already been diagnosed with sleep apnea. If that happens, I ask them about their c-pap use. Most people tell me they have it in a drawer somewhere.
Really adamant about not being somebody that wanted to wear a c-pap or carry one around with me, and said that up until that point in my life, my ignorance was bliss, and I would just as soon stay that way if I had to use a c-pap machine.
And so then I say, well, there is something that you can do, and that's just been so amazing, being able to help these patients who felt so tired and had bad memory, and their wife wouldn't, they slept in separate bedrooms, and now I can help solve all those things.
Surprisingly, I must say, it was not uncomfortable, and it wasn't a big deal to wear at night like I thought it might be, and it actually just was quite simple. I will say on a footnote that the first night of wearing it, my wife thought I had died because I wasn't making any noises.
The best thing you can do is, if you suspect that you have sleep apnea or the person you're sleeping with has sleep apnea, is to just call. Pick up the phone. Even if you don't have a sleep study, even if you don't have a diagnosis and you haven't talked to your doctor about it, call. I work with doctors, I work with sleep labs, I keep everybody informed, and the most important thing is just getting help. You don't have to feel like this anymore.